it's Dr. Rick. So are you talking about the new vaccine? Everybody else is. The NHS COVID-19 vaccination programme is now officially underway. In Manchester last week, 2 sites were giving out the jabs. The first was at Stepping Hill Hospital in Stockport, and the second was Salford Royal Hospital. The reason why these 2 were chosen first is because they had the kit to store the vaccine at minus 70 degrees and also the systems to vaccinate vulnerable people and essential NHS staff. There are some concerns currently about the new Pfizer vaccine, the one that's currently being given out, regarding allergies. It's been recognised that any vaccine given to anybody can potentially cause an allergic reaction, and health services have always been careful to consider this risk. But the new Pfizer vaccine, the one that's currently being given out, there does seem to be a problem in some people having what's called an anaphylactic reaction. This reaction is thankfully still very rare, and to a large degree we can figure out who may be at risk of having this reaction. But firstly, let me tell you what happens in an anaphylactic reaction. Firstly, the reaction is quick, sudden onset, usually within a couple of minutes. There may be swelling of the throat and difficulty breathing. Your pulse goes up and your blood pressure comes down, and some people feel so bad they pass out. Now, in order to take this risk very seriously, every single vaccination site for the COVID-19 programme will have rescue equipment on site, including anaphylaxis kits, which involve lots of medications, and a defibrillator. There will always be a trained medic on site. And most importantly, everybody who gets the jab has to stay for 15 minutes after the immunisation to make sure they're okay before they head off. But most importantly, for safety, we need to figure out who is at risk of one of these reactions. If you've had multiple allergies in the past and had any of the symptoms of an anaphylactic reaction, you should not be having this Pfizer vaccination. The NHS is working hard with general practitioners to identify people who could be at risk and to have the conversation with them in advance or delay their invitation for this vaccination. But I would certainly stress that this vaccination is safe for the vast majority of people, regardless of their current medical conditions. But if you have an allergic reaction in the past, which has been serious enough to use an EpiPen or a hospital admission or to affect your breathing, you should certainly ask the questions in advance whether this vaccination is safe for you and whether it would be a good idea to delay your vaccination and have one of the other jabs which is currently under consideration for the NHS use. The NHS is taking safety very seriously.